Now to your community focus. As we told you earlier in this newscast, Hasbro Children's Hospital is over capacity.
That's with COVID still around, plus cases of RSV and the flu. Joining us to talk about all of that live via Zoom today is Dr. Philip Chan from the Rhode Island Department of Health. Thanks so much, Doctor, for being with us.
Thank you for having me.
So let's start with RSV. I will admit, as a new mom, I had never heard of RSV until this year, and frankly, it's kind of alarming. I know this is an issue nationwide, so why is it such a problem this season?
So RSV is a very common respiratory virus. It's been around forever. We've known about it in the medical community. It typically affects very young kids under the age of 2. Get very sick with it because airways are so small, and these kids can develop essentially pneumonia and very deep respiratory infection. What's happened this year is because of the last couple years, we've been masking and physically distancing. We've seen historically low rates of RSV and flu. And now that we're back to normal, we're seeing these cases rise again. And unfortunately, we've seen about a doubling of our RSV cases due to relaxing some of these precautions, and that's really overwhelmed the hospitals, and especially Hasbro Hospital.
So what signs should parents be on the lookout for, and what can we do, if anything, to protect our kids from getting it?
Well, the good news is that everything that we know that protects against COVID also protect against these other respiratory viruses, whether or not it be RSV or flu. Things like masking and physical distancing and ventilation and washing your hands, all these things that we've been stressing the last couple of years, and that will help prevent RSV. The most serious thing about RSV is for people that have trouble breathing. If anyone ever has trouble breathing, whether it be kids or adults, that can be a medical emergency, and people should certainly go to an emergency department right away. For other sort of more mild respiratory complaints, we're really encouraging people to check in with your primary care doctor first or another clinic to help take some of the stress off of the emergency departments.
Dr. Chan, the Washington Post had a headline today that said, quote, flu season 2022 started a month early. Severity is highest in 13 years. It's right around the corner. What does it mean for the winter months?
So in addition to RSV, we are seeing this triple epidemic of respiratory viruses. So we have RSV, which we just talked about, we have flu, and of course, COVID is still hanging around. So again, just things like getting your flu shot. The flu shot is pretty good this year in terms of preventing flu. Definitely get your flu shot. And again, all those other things that we know that protect against these respiratory viruses will also protect against flu.
So we're talking about RSV and how it's dangerous for kids. You just mentioned the flu. Who's most vulnerable for this?
So similar to COVID, the people that are most vulnerable to the flu do tend to be people that are older, do tend to be people who are immunocompromised for other significant medical conditions. So people in those groups, of course, not need to only get boosted for COVID, but should also definitely get their flu vaccine.
And Dr. Chan, just quickly before we let you go, Halloween is on Monday. We often hear some sort of scary warnings around this time of year about candy or snacks laced with drugs or needles or razor blades. Many of those reports get debunked, though. So what are the real health and safety issues parents should be worried about on Monday?
Great question, and happy Halloween. I have a couple kids. I'm looking forward to getting out there myself. I think just some of the basics, using sidewalks instead of walking in the street, reminding kids just some general common sense safety, never to enter homes or apartments unless accompanied by an adult. And just if you're driving, just take it slow, and especially as it starts to get a little bit dark out, just be careful because kids, including my own, be trick-or-treating out there. And other than that, enjoy some candy, just don't go overboard. But obviously candy is part of Halloween. I'm looking forward to getting out there myself, and happy Halloween, everyone.
Everything in moderation. All right, happy Halloween to you, and thanks for joining us, Dr. Philip Chan.
Thank you for having me.